Hello and welcome back to my channel. So before starting the vlog for today, I would like to request those who are new to my channel and also those who have not subscribed to my channel, please do subscribe it and also press the bell icon so that you get notified every time I come up with a new video. So today's topic of discussion, as you have already seen from the thumbnail and from the title itself, is the lymphatic filariasis and elephantiasis. So before starting the vlog, I have put a picture on your screen right now. I hope it is clear to you all. Basically it is a picture of a patient who is suffering from filariasis. आप देख सकते हो कि उसका जो पैर है इस इंसान का वो किस हद तक फुला हुआ है. ठीक है, इसके पैर में आप swelling देख सकते हैं. ठीक है, so you can see the swelling in his leg. So basically it is caused by the parasite called as Wucheria bancrofti in 95% cases, sorry. And we will see that what types of filariasis are there further, and which part of the nation and the world is being affected with it, what is the incubation period, what is the pathophysiology, and what are the diagnosis and the treatment of this disease. Okay, so firstly, as you can see that I have written down the notes for you all. So here I have written down the notes so that we can easily sum up the things, because while explaining and writing it simultaneously, it takes a lot of time and the video becomes quite longer. So I have already written the notes here so that I can explain you. So what is the definition? Basically it is an infection, or we can say a tropical disease, which is caused by any one of the several thread-like parasites, roundworm, or we can also say nematodes. Okay, these filariasis is of two types: lymphatic filariasis and non-lymphatic filariasis. Lymphatic filariasis has the parasite called as Wucheria bancrofti, Brugia malai, and Brugia thimori. So one thing one should note down is that in the NEET examination, it is often asked that what is the vector of filariasis. So one should know that Wucheria bancrofti is responsible for the 95% cases of the filariasis, as I have written it here also. So its vector is Culex mosquito. So the answer of this question would be Culex mosquito. Okay, Brugia malai and Brugia thimori is being transmitted by the help of Anopheles mosquito. Okay, and non-lymphatic filariasis is having the parasite called as Loa loa, and the second one is onchocerciasis, which is called as the river blindness. Okay, and the Loa loa parasite causes the Loa loa filariasis. Okay, this note I have already discussed. Okay, 95% cases responsible for that. The Wucheria bancrofti is responsible. And the states, okay, the Indian state, the part of the nation which is being affected by it mostly is the Uttar Pradesh. In India, we are talking about Uttar Pradesh, Bihar, Andhra Pradesh, Kerala, Jharkhand, and Tamil Nadu. Okay, these are the 6 states which are mostly affected with filariasis, and in the world, Southeast Asia is affected with this. Okay, incubation period is about 1 year, and there is an extrinsic incubation period is also there, which is about 14 to 15 days. It is for the we can say the parasite remaining inside the time for which the parasite remain inside the mosquito. Okay, that is 14 to 15 days. Okay, so now I will tell you about the life cycle of the parasite inside the human body, and furtherly in the mosquito. So what happens when a mosquito comes and sits on the skin of the person and tries to insert the proboscis inside the skin? That time we can see that the larva, the parasite's larva sorry, the parasite's larva is present in the stage of L3 inside the salivary gland, of the mosquito. So what happens when the mosquito enters the proboscis inside the skin and pierces the epidermis and dermis? The larva, which is in the L3 stage, will immediately go inside the lymph vessels present in the dermis and will undergo the process of molting. Okay, molting मतलब क्या? Molting मतलब कि it tries to reproduce, it tries to mature itself. Okay, not reproduce, we will say that it will mature. Okay, and it will form the adult this parasite. Here we have taken the Wucheria bancrofti, so it will mature and it will form the adult Wucheria bancrofti. Okay, here one thing you should know that the L3 will undergo the third and the fourth molting to form the adult one. Okay, Before moving forward, we will see the relation between the blood vessels and the lymph vessels. Here the blood vessel is drawn with the red, and this one, the black one, is the lymph vessel, and in between them is the tissue area. Okay, so what happens, we know that the blood vessel is having the RBCs and the plasma inside it. When the pressure increases in the blood vessels, the plasma will leak out through the pores present on the walls of the blood vessel and go inside the tissue. Okay, and from the tissue it will further go inside the lymph vessels by the walls of the lymph vessels. Okay, but to maintain the concentration of the blood flow, these lymph vessels are furtherly connected to the blood vessels. Okay, this concept is clear, I feel. So what happens, now we will start from here. What happens, the lymph vessel having the adult Bucheria bancrofti, that adult can be a female or that can be a male. Okay, when the male and female mate, they will form a larva which is having a egg sheath around it, and that is called as microfilary. And when this microfilary will come, because we know that the lymph vessel, this is the lymph vessel, this one is the lymph vessels, and this is interconnected with the blood vessels. So what happens, this microfilary will run inside the blood of the human, and when a mosquito bites again that infected person, the microfilary will go inside the mosquito body and enters the gut. Okay, and one thing, this which I am calling that microfilary is the L1 larva. Okay, when it enters inside the mosquito's gut, there it will try to dissolve the egg sheath. Okay, the egg sheath will be dissolved and the larva will be released, and that larva, what it will do is that it will invade the gut wall. This blue one is the gut valve. It will try to invade the gut valve and come inside the thoracic muscle, and when it comes inside the thoracic muscle, it will undergo its first and the second molting and to form the L3 larva. Okay, so here it will form the L3 larva, and this larva again will come to the salivary gland of the mosquito. So in this way this whole cycle runs. And the other question which one might ask is that why we see the swelling in the filariasis patients. So the answer is that, one second. See, here I have made a small diagram to make you understand that in the lymph vessels we have the adult form of the parasites that we have discussed earlier. So what happens, these adult parasites will make the valve of the lymph vessels dilate, because of which what happens, the tissue fluid which is present here that we have discussed will not be able to come inside the lymph vessels. Because of that, the tissue fluid will accumulate inside the tissue, or we can say the plasma will accumulate inside the tissue, because of which the tissue will swell up. So this is the reason why we see the swelling in the patient suffering from the filariasis. Okay, mostly the swelling can be seen in the upper limb and the lower limb, or the nipples of the woman, and this penis inside, or the penis in men. Okay, so here are some points which are important to know, that during this filariasis patients suffer from fever, chill with rigor. Rigor means hota hai kapkapi aana. And the microfilary which are the L1 larva, ये जो होता है ये हमेशा रात में ही मतलब कह सकते हैं सर्कुलेट करता है, निकलता है पेरिफेरल ब्लड फ्लो में. ओके, एंड जो इनकी फिलारियासिस होता है, इट इज़ मोर कॉमन इन द फीमेल्स ऑफ द एज ग्रुप 20 to 30 years. And one more important thing that one should know is that there is a national vector-borne disease control program to eradicate the dengue, malaria, kala azar, chikungunya, Japanese encephalitis and filariasis. Okay, these 6 diseases को to eradicate these 6 diseases ये एक program चलाया जा रहा है. This question might ask in the NEET examination that which program is being held to eradicate these 6 diseases. So the answer would be National Vector-Borne Disease Control Program. Okay, and the management of the disease is primary and secondary. For the primary one, we should maintain the sanitization around us, and for the second there are 3 drugs, that is DEC, diethyl carbazine, and albendazole and ivermectin. Okay, furtherly we will discuss about the treatment. This is the basic primary and secondary management. Okay, So here I have written the grades of the filariasis, that is the first, second, third, and fourth. So what happens in the series of development, or we can say that how this disease becomes bigger one by one. Like if you are in stage 1, what happens that you will see the lymph edema, that is the collection of the lymph inside the tissue due to the lymphatic blockage. As I have already told you that the adult parasites are inside the lymph vessels and they block the drainage of the tissue fluid, or we can say the tissue fluid inside the lymph vessels, because of which the tissue becomes we can say that tissue has an excess collection of fluid which is called as lymph edema. Okay, and this is of pitting type, means अगर आप उसको प्रेस करोगे तो उस पर गड्ढा पड़ जाए, पिट टाइप का हो जाएगा. ओके, ट्रीटमेंट क्या है? एलिवेटिंग द लेग. ओके, कुछ टाइम के लिए एलिवेट कर सकते हो लेग. ओके, स्टेज सेकंड में क्या है कि इसमें आपको पिटिंग टाइप एडिमा नहीं देखने को मिलेगा, बट ऑन एलिवेशन ऑल्सो आपको पेन में आराम नहीं होगा, स्वेलिंग एज इट इज़ बनी रहेगी. ठीक है, इट मीन्स दैट यू आर इन स्टेज सेकंड. स्टेज थर्ड में क्या होता है? क्रोकोडाइल स्किन, मीन्स स्किन काफ़ी रफ़ हो जाती है और जो स्किन होता है उस पर अल्सर बनने लगता है. ठीक है, यानी कि छाले. स्टेज 4 में क्या होता है कि स्टेज थर्ड के सिम्टम्स रहते हैं, यानी कि रफनेस रहेगी स्किन में, अल्सर रहेगा, साथ ही साथ बहुत अनयूजुअल सी स्वेलिंग आपको देखने को मिलेगी स्किन पे. सो बेसिकली ये जो स्वेलिंग होती है वो लोअर लिम्ब के एरियाज़ में, अपर लिम्ब के एरियाज़ में और पेनिस और निपल पे देखने को मिलती है. ठीक है. So again, this is the tropical eosinophilia, means the pulmonary eosinophilia means what happens, ये एक hyper responsive pulmonary syndrome होता है which is because of the response, or we can say it is against the response to the trapped microfilariae. It inhibits the lymphatics and the bloodstream. एक minute. So here is the one more important point that one should know while we are discussing about the microfilariae. So here is again a very important point, that is the tropical eosinophilia, that is the pulmonary eosinophilia. What happens in this? This is an hyper-responsive pulmonary syndrome. In response to the trapped microfilariae, it inhibits the lymphatic and the bloodstream. What happens कि because of the microfilariae, it is basically a disorder because of the microfilariae, that the microfilariae, as we have seen earlier, that it travels inside the blood in the form of L1 larva. So because of excess we can say microfilariae, the blood streams can be trapped, or the lymphatic vessels, while they are traveling in the lymphatic vessels in L3 stage, then also they can trap the lymphatic vessels, and because of that there can be hyper responsive pulmonary syndrome disorder which can be caused and it can make the person breathless. Okay, and so it is very dangerous also at the same time. Okay, now we will. सो व्हाट इज़ द डायग्नोसिस? बेसिकली क्या होता है कि जो माइक्रोफिलरे होते हैं, एज आई हैव टोल्ड यू अर्लियर, कि वो हमेशा रात में ही ट्रैवल करते हैं, उनकी साइकिल जो होती है वो रात में ही पूरी होती है. तो हम लोग क्या करते हैं, नॉक्चुरल पीरियोडिसिटी चेक करते हैं माइक्रोफिलरे की. ठीक है, ड्यू टू द नॉक्चुरल पीरियोडिसिटी ऑफ द माइक्रोफिलरे, ब्लड सैंपल इज़ टेकन एट द नाइट. सो हम लोग रात में ब्लड सैंपल लेते हैं ताकि हम लोग माइक्रोफिलरे की प्रेजेंस को देख सकें, क्योंकि सर्कुलेशन जो होता है ये वाला माइक्रोफिलरे वाला, ये हमेशा रात में ही होता है. ये जो लाइफ साइकिल है ये हमेशा रात में ही कंप्लीट हो पाती है, इसीलिए ड्यूरिंग द नाइट ब्लड सैंपल ले करके इसकी प्रेजेंस को देखा जाता है और कंफर्म किया जाता है. ठीक है, ग्लेम्सा स्ट्रेन होता है जिसमें हम लोग इसको चेक करते हैं. And the other thing, the other test that we can use is DEC provocation test. What happens कि DEC देते हैं, यानी कि डाईइथाइल कार्बाजीन हम लोग देते हैं, जिसकी वजह से क्या होता है कि जो चीज़ हम लोग रात में देख रहे हैं, यहाँ पे माइक्रोफिलरे निकल रहे हैं, साइकिल कंप्लीट हो रही है, वो चीज़ डाईइथाइल कार्बाजीन देने की वजह से दिन में भी हो सकती है. इसीलिए हम लोग क्या करते हैं, हम लोग इसको दिन में देते हैं ताकि माइक्रोफिलरे निकले और हम लोग उसका ब्लड सैंपल ले करके 20 से 15 मिनट जैसे कि दिया है कलेक्ट करते हैं ब्लड, और माइक्रोफिलरे की प्रेजेंस को हम लोग वहाँ पे देख सकते हैं. ठीक है. तो यहाँ पे क्या लिखा है कि इंड्यूस द माइक्रोफिलरी इन पेरिफेरल ब्लड इवन इन द डे टाइम 20 to 15 मिनट्स लगेगा आपको ये देखने को मिल सकता है माइक्रोफिलरी, ओके, क्योंकि ये बेसिकली रात में निकलता है, लेकिन हम लोग इसको DEC अगर देंगे तो ये दिन में भी हमें देखने को मिलेगा ब्लड सैंपल में, ठीक है। अदर थिंग दैट वी कैन डू इज़ लिम्फ नोड बायोप्सी करा सकते हैं। एक्सरे में अगर हम लोग देखें, अगर वॉर्म जो है यानी कि जो आपका राउंड वॉर्म है, अगर वो कैल्सीफाई हो गया तो आपको एक्सरे में भी देखने को मिलेगा। eosinophil इन द ब्लड, यानी कि जैसे कि ट्रॉपिकल दिस eosinophilia होगा तो आपको eosinophil भी देखने को मिलेगा, ठीक है। IgE निकलेगा, वो भी दिखेगा। एंटीजन्स लाइक एलाइजा हम लोग कर सकते हैं, ICT, एंड एंटीबॉडी के लिए CFT, IHA एंड IFA कर सकते हैं, ठीक है। फॉर द ट्रीटमेंट पार्ट व्हाट वी कैन डू इज़ दैट हम लोग DEC देंगे, दैट इज़ डाईएथाइल कार्बाजीन 6 mg पर kg बॉडी वेट के हिसाब से देंगे। पर डे देना रहता है, 12 दिन तक ये डोज चलेगा। ऑल्सो हम लोग DEC के साथ मेट्रोनिडाजोल भी दे सकते हैं 6 mg, ठीक है। ये इसकी ट्रीटमेंट हो गई। सो दैट्स इट फॉर द व्लॉग। आई होप यू पीपल लाइक द व्लॉग, एंड इफ़ यू डिड प्लीज़ गिव इट अ थम्स अप एंड ऑल्सो सब्सक्राइब टू माई चैनल। थैंक यू सो मच।